My name is Zhang. I'm a general gastroenterologist. My medical interests, in addition to treating patients with gastrointestinal disorders, I also focus on treating patients with esophageal disorders and disorders of swallowing. This includes a broad range of topics such as acid reflux, Barrett's esophagus, esophageal motility disorders, patients with complex strictures who need dilation. Well, I've been practicing medicine since 2016. I perform the upper endoscopy and colonoscopy procedures, but in addition to that, I also perform specialized procedures that aim to detect abnormalities in the esophagus and that aim to improve the function of the esophagus. So in the last 10 years, there's been a lot of new advancement that's helped with our understanding of how the esophagus works. And there's been a lot of new advancements that's helped with managing disordered esophagus. This can include non-invasive testing with certain balloon devices. In addition, there's something called the EndoFlip, which is a balloon in the esophagus that can measure the contractility, how the esophagus squeezes. And then there are new anti-reflux procedures that can be done endoscopically to reduce the amount of acid reflux in certain selected patients. I think what makes Scripps special is that we have experts in all of the fields that are necessary to take care of patients with complex swallowing disorders and complex esophageal disorders. Those experts can involve the gastroenterologist, the ear, nose, and throat physicians, the foregut surgeons, the allergists, the speech and language pathologists, the registered dietitians, GI psychologists, among other experts. And I really do believe that it takes this team to work together to be able to provide our patients with the best outcomes. In my clinic, I really emphasize teaching the patient and educating them on what their testing means, what their diagnosis means, and the risks and benefits of their therapies moving forward. I'm a big foodie. Whenever I'm going to different cities or wherever I'm living, I love to try out the different restaurants and just check out all my favorite foods. And I think being able to eat is a very important part of life. It's important social activity. And for those patients who are not able to eat, who have trouble swallowing, it really changes their life. And so in my mind, being able to see a patient and manage their disease and to get to a point where they can eat their favorite foods again, I think that is extremely gratifying.